reports from health monitoring agencies across Europe indicate a significant and sustained increase in cases of Puumala Hantavirus, the primary agent behind a regional form of hemorrhagic fever with renal syndrome. Historically, the Puumala strain, or PUUVV, has been characterized in clinical literature as the cause of nephropathia epidemica, a generally milder variant of hantavirus infection that predominantly targets the kidneys. However, new surveillance data and clinical findings from the early months of 2026 suggest a shift in how the medical community views this pathogen's impact. While the New World hantaviruses found in the Americas are notorious for causing high-fatality hantavirus pulmonary syndrome, or HPS, researchers are now observing that the European Puumala strain is increasingly associated with severe pulmonary complications alongside its traditional renal symptoms. This dual threat profile, attacking both the lungs and kidneys with similar intensity in severe cases, has prompted renewed focus from the European Center for Disease Prevention and Control, known as the ECDC, and various national health institutes. The geographic concentration of these spikes remains highest in areas with dense populations of the bank vole, the primary natural reservoir for the virus. Finland and Germany continue to report the highest annual incidences, often accounting for over 60% of European cases. But recent spikes have also been noted in Hungary, Austria, and Sweden. This rise in infections often follows mast years, where an abundance of forest seeds leads to an explosion in the rodent population. As these rodents move closer to human dwellings in search of food or shelter, the risk of zoonotic spillover increases. Public health officials emphasize that while many Puumala infections remain subclinical or mild, the current trend of multi-organ involvement makes early detection more critical than ever. The framing of hantavirus as strictly a kidney version in Europe is being challenged by these emerging clinical realities, where impaired gas diffusion and pulmonary edema are appearing as hallmark symptoms in hospitalized patients. This evolution in the disease profile means that diagnostic protocols once focused primarily on renal function must now broaden to include comprehensive respiratory assessments. For viewers and residents in endemic regions, understanding the mechanism of this spillover is essential. The virus is not spread through casual contact between humans in most cases, but is instead contracted through the inhalation of aerosolized droppings, urine, or saliva from infected voles. As we move further into the 2026 season, the convergence of high rodent density and these more complex clinical presentations has placed European public health surveillance on high alert. Central to the current developments is a series of laboratory studies and clinical reports published in early 2026 that clarify why the Puumala strain appears to be increasingly affecting the lungs. Research released in March 2026 by virologists and clinical teams in Northern Europe has highlighted a specific mechanism involving hyaluronan metabolism. In severe Puumala cases, the virus appears to dysregulate how the body produces and breaks down hyaluronan, leading to an extensive accumulation of this substance in lung tissue. This accumulation is directly correlated with disrupted alveolar architecture, causing the lungs to struggle with oxygen exchange. This finding is a significant departure from the traditional understanding of Puumala as a primarily renal-focused pathogen. In the laboratory, researchers used bronchoalveolar lavage fluid and lung tissue from fatal cases to demonstrate that high molecular weight hyaluronan levels were elevated in patients with the greatest pulmonary impairment. This clinical overlap between the European HFRS and the American HPS is causing a reevaluation of treatment priorities in intensive care units. Hospitals in Germany and Finland are reporting that while renal failure and proteinuria remain common, a subset of patients is rapidly progressing to acute respiratory distress syndrome, or ARDS. This has made the diagnostic window narrow and the stakes for laboratory testing much higher. Currently, the primary diagnostic methods involve enzyme-linked immunosorbent assays, or ELISA, to detect specific IgM antibodies, as well as polymerase chain reaction, or PCR, tests to identify the viral RNA itself. However, because the initial symptoms of Puumala infection, high fever, intense headache, and abdominal pain are nonspecific, Many cases are initially misidentified as common influenza or other gastrointestinal illnesses. The ECDC has noted that the silent nature of the virus means that for every laboratory-confirmed case, several others may go undiagnosed. Surveillance efforts are also being complicated by the emergence of other hantavirus clusters, such as the high-profile incident on a cruise ship in the South Atlantic in May 2026, although that specific outbreak was linked to the Andes virus, a South American strain capable of rare person-to-person transmission. The incident has heightened global sensitivity to hantavirus symptoms. In Europe, the focus remains firmly on the Puumala strain and its ecological drivers. Data from Hungarian forestry workers and small mammal surveys show a seroprevalence of nearly 5% in high-risk occupations, confirming that the virus maintains a sustained presence in the environment. Public health agencies are currently balancing the need for rapid clinical response with the ongoing effort to map the genetic lineages of the Puumala virus, ensuring that diagnostic tools remain effective against localized variants appearing in Central and Southeastern Europe. Prevention and surveillance remain the most effective tools in managing the risk of hantavirus, as there is currently no widely available vaccine or specific antiviral treatment for the Puumala strain in Europe. Public health guidance remains consistent. The most significant risk factor is the cleaning of enclosed spaces that have been infested by rodents, such as sheds, barns, attics, or summer cottages. Experts advise against dry sweeping or vacuuming in these areas, as these actions stir up the very dust that carries the virus into the air. Instead, the use of disinfectants or a bleach solution to wet down surfaces before cleaning is recommended to keep particles from becoming aerosolized. In addition, the use of high-efficiency masks and gloves is considered standard protocol for those in high-risk environments. Surveillance programs are increasingly looking at eco-epidemiology, which involves monitoring the population cycles of the bank vole. By tracking forest masting events, scientists can often predict an upcoming spike in human cases several months in advance, allowing for targeted public health campaigns. Despite these efforts, there are honest limits to our current knowledge. While the March 2026 findings on hyaluronan accumulation provide a breakthrough in understanding the pulmonary impact, it is still unclear why certain individuals develop these severe lung symptoms while others experience only mild, flu-like illness. The role of host genetics and the specific viral load at the time of exposure are areas of ongoing investigation. Furthermore, while person-to-person transmission is a known characteristic of the Andes virus in South America, it remains an extremely rare and unverified concern for the Puumala strain in Europe, which is almost exclusively rodent-to-human. As we look toward the remainder of the year, the goal for health agencies is to reduce the time between symptom onset and specialized care. Clinicians are being advised to consider hantavirus in any patient presenting with the triad of fever, acute kidney injury, and respiratory distress, especially if they have a history of rural or forest exposure. The situation remains a potent reminder of the complex relationship between human health and environmental fluctuations. Public health officials urge a calm but vigilant approach, noting that while the virus is serious, the risk to the general urban population remains very low. Staying informed about local rodent activity and following proper safety protocols during seasonal cleaning can significantly mitigate the danger. To stay updated on evolving public health reports and virology news, consider subscribing to this channel for further evidence-based reporting. The core development defining the 2026 outbreak is the significant divergence from the traditional clinical profile of the Puumala orthohantavirus. While medical literature has historically categorized this European strain as the cause of nephropathia epidemica, a generally manageable form of hemorrhagic fever with renal syndrome, new patient data from clinics across Germany, Finland, and Sweden are presenting a more aggressive clinical reality. Clinicians are reporting an increase in patients hospitalized with simultaneous acute kidney injury and significant pulmonary impairment, a dual-organ attack that mirrors the more lethal hantavirus pulmonary syndrome typically found in the Americas. In high-density care units, the standard of care has shifted toward aggressive monitoring of respiratory function alongside renal output. Laboratory findings released in the first quarter of 2026 indicate that the Puumala virus is inducing a specific systemic response where hyaluronan, a carbohydrate naturally produced by the body, accumulates excessively in the lung tissue of severely ill patients. This accumulation is believed to disrupt the alveolar capillary barrier, leading to pulmonary edema and a dangerous drop in oxygen saturation. This laboratory insight is a critical development, as it provides a scientific mechanism for why the Puumala strain is no longer presenting strictly as a kidney-focused pathogen. As of May 2026, the European Centre for Disease Prevention and Control has intensified its calls for rapid laboratory verification to manage the spike. The current diagnostic gold standard remains the detection of virus-specific immunoglobulin M and G antibodies through enzyme-linked immunosorbent assay, or ELISA. However, because the initial prodromal phase of the illness, marked by high fever, intense headaches, and muscle pain, is virtually indistinguishable from common seasonal influenza or other viral infections, early testing in endemic regions is now a priority for public health agencies. In diagnostic centers in Helsinki and Berlin, real-time polymerase chain reaction, or PCR, testing is being deployed to identify viral RNA in the blood during the earliest stages of infection. Though officials note the window for capturing the virus in the bloodstream is often very short. The current surge is largely attributed to the mast year phenomenon observed across European forests over the last year. During these periods, a surplus of seeds from trees like beech and oak provides an overabundance of food for the bank vole, which serves as the primary natural reservoir for the Puumala virus. This has led to a documented population explosion among the rodents, significantly increasing the environmental viral load and the statistical likelihood of human-animal contact. The Global Health Surveillance Network is also analyzing these European developments in the context of recent Hantavirus activity elsewhere. Earlier this year, a high-profile incident involving the Andes Hantavirus on a cruise ship in the South Atlantic served as a global reminder of the persistence of these zoonotic threats. While the Andes strain in South America is notably capable of rare person-to-person transmission, the Puumala strain in Europe continues to be transmitted almost exclusively through the inhalation of aerosolized rodent excreta. Nevertheless, the international shipping and logistics sectors have faced increased pressure to bolster pest control measures to prevent the movement of infected rodents through global trade routes. Health officials emphasize that while the strains and transmission modes vary, the emerging trend of hantaviruses causing more severe multi-organ complications is a shared global concern that requires standardized clinical reporting. In the current reporting window, confirmed case numbers in Hungary and Austria have also trended upward, confirming that the ecological drivers of this spike are widespread. Hospitals across the continent are being advised to maintain a high index of suspicion for any patient with a history of rural or forest exposure who exhibits a rapid decline in both renal and respiratory markers. As these developments continue to redefine the risk profile of the Puumala strain, in response to the shifting clinical profile of the Puumala strain, public health agencies are emphasizing a dual strategy of environmental surveillance and targeted prevention. Because there is currently no commercially available vaccine for hantaviruses in Europe or North America, and no specific antiviral therapy like ribavirin has shown definitive efficacy against the Puumala strain in clinical trials, the burden of protection rests on minimizing human exposure to the bank vole. This small rodent, known scientifically as Myodes sclerulus, remains the exclusive host for the virus in the European landscape. Effective prevention requires a sophisticated understanding of rodent behavior. As populations peak following mast years, seasons of high seed production in deciduous forests, the risk to humans rises exponentially. Public guidance issued in 2026 highlights the critical importance of proper hygiene during the cleaning of seasonal residences, sheds, and woodpiles. Health officials stress that the virus is shed in the urine, saliva, and feces of infected voles and remains stable in the environment for several weeks. The primary danger occurs when these materials are disturbed and become airborne. Therefore, the core practical takeaway for those in endemic regions is the strict avoidance of dry sweeping or vacuuming in potentially infested areas. Instead, experts recommend a wet cleaning protocol, thoroughly soaking contaminated surfaces with a 10% bleach solution or a commercial disinfectant for at least 5 minutes before wiping. This process ensures that viral particles remain trapped in liquid and are not inhaled as hazardous aerosols. For individuals in high-risk occupations, such as forestry workers, farmers, or construction crews specializing in renovations, the use of high-efficiency particulate air masks, specifically N95 or FFP3 grade respirators, is considered a mandatory safety standard to prevent zoonotic spillover, despite these clear mechanical interventions. Significant gaps in scientific knowledge remain, which officials are addressing with transparency. One of the most pressing questions in 2026 is the biological reason behind the increased severity of pulmonary symptoms in recent European cases. While the link to hyaluronan dysregulation offers a promising lead, it does not fully explain why the disease remains subclinical or mild in the majority of patients while causing life-threatening multi-organ failure in a small percentage. Researchers are currently investigating host genetic factors, such as specific HLA-type variations, which may predispose certain individuals to a more violent immune response known as a cytokine storm. Furthermore, while the Puumala strain is generally considered a non-communicable pathogen between humans, the medical community remains vigilant in monitoring for any genetic mutations that could alter its transmission dynamics. Surveillance programs are now integrating satellite-based ecological monitoring to predict vole plagues by tracking forest canopy density and seed cycles, allowing for localized health warnings months before an outbreak reaches its peak. This proactive One Health approach recognizes that human health is inextricably linked to the stability of the local ecosystem. As we conclude this report, the ethical focus remains on providing a balanced perspective that acknowledges the severity of the virus without inciting undue alarm. For the vast majority of the population living in urban centers, the risk of hantavirus remains negligible. The threat is concentrated among those who live, work, or recreate in rural and forested environments where the bank vole thrives. Reporting on these spikes is intended to empower the public with the specific knowledge needed to manage their own risk through simple, effective environmental controls. The shift in the Puumala strain's impact on both the lungs and kidneys is a serious development, but it is one that medical science is rapidly deconstructing through rigorous lab-based inquiry and improved clinical protocols. By maintaining a calm, evidence-based approach to zoonotic diseases, society can better navigate the interface between human expansion and the natural world. For further updates on global health surveillance and the latest findings in clinical virology,